Welcome to episode 196 of the Urology Coding and Reimbursement Podcast. I'm your host, Scott Painter, with my co host, Mark Painter, and Dr. Ray Painter. And we want to welcome special guests, Dr. Una Lee and Dr. John Lynn. And we wanted to go through this and do an episode. And I'll let Dr. Lee and Dr. Lynn, when I go to them, explain where they are in practice and what size of group. And I'm sure we've had Dr. Lynn on before, so you may all be familiar. A lot of our audience is familiar with Dr. Lynn, but I'll have him repeat kind of what he's up to, where he's practicing, and as well as this is their first time for Dr. Lee. So we want to welcome both Dr. Lynn and Dr. Lee on the podcast. So we're excited to have them today. And what we wanted to cover is, and we mentioned this in episode 193, that we were on the way to the AUA meeting, and Mark, Dr. Lynn, Dr. Lee, and Dr. Pablo Santamaria had a course in the business side of the AUA track, and we wanted to get their feedback or get their ideas on what it was and some of the big takeaways that they had or they wanted to convey in that presentation. So we want to start it off with Mark first. Would you please take us through how it all came together and what you were trying to do?
Sure. So this was actually a pretty fun course to put together. Dr. Santamaria came to me and said he would like to do some speaking at the AUA. And so we put in for a presentation at in the ILB track of the AUA. The course was accepted, and Dr. Santamaria asked me to select a couple of folks. And what we tried to do was build a little bit of a representation of urology around the country. So Dr. Lynn, who I've worked with so many times, was an obvious choice as a solo practitioner out there to give some good insight. And obviously he's seen some of the other groups out there. And then Pablo or Dr. Santamaria actually is now in academics, but started his practice in private practice, then worked for a big hospital system, and then moved into academics. So he's seen a little bit of all of it. And then I recommended Dr. Lee. I've known her for years, because of the Washington State Urological and our partnership with Washington State Urological. But Dr. Lee is an amazingly productive physician within a large organization and has over the years risen to the top and driven a lot of different initiatives within Virginia Mason. So it seemed like a good mix to give some general feedback to everybody on how to actually survive urology, regardless of what setting you're in. So we kind of broke it up a little bit, and Dr. Santamaria started us off giving an overview of how he'd progressed through his career and all the different things that he went through from his first day on the job, when he actually happened to arrive and see a letter from Medicare warning him about making sure he was billing correctly, and actually became a CPC, one of the first urologists to get become a certified coder. All of that partially due to, of course, the OG, Ray, and his push for urologists to learn coding across the board. So he talked about, how he quickly picked up billing, coding, and documentation, and really built systems and documentation templates, and really tried to work through the process of laying down hit all the administrative stuff and working it behind him, so that he could finish his day. And he quickly became the highest producer in his practice, and kind of moved forward along that line. And it's too bad he's not with us today, because he lends a little bit of a nice little folksy push to it because of his delivery style. Just a fun guy to work with and a good guy overall. And then we turned it over to Dr. Lee to talk about patient experience, and then I think that was the way it went. And then Dr. Lin talked about how he went through everything, and I'll let them kind of recap what they did. And then I got to fill the last few minutes, and we also had a bunch of questions, and the audience was good in their participation across the board. So I'll pitch it now to Dr. Lee and kind of let you walk through kind of what you covered in your program.
Sure. Thank you for having me. I do recall the audience was super engaged, and that's really fun to just, we spent a good amount of time on the questions and the answers, and that course is available through the AUA. I think the audio or I'm not sure if the video, but definitely the slides. So
it's a combination of audio and slides, and they correlated the two, so you can really get an immersive experience. It's through the AUA's Institute for Leadership in Business. So audience members who are thinking about getting that course, you would look that up there.
Yeah, I really like that track. I think that there's just so many great, courses on efficiency and business leadership. It's like this parallel track to sort of the clinical side, and I think they've done a really good job with it. And we had a great audience, and so that definitely led to some lively conversation. But so my name is Una Lee. I am a urologist who specializes in female urology, female pelvic medicine, and reconstructive surgery. Now it's renamed urogynecology. And I grew up in Ohio. I did my undergrad at Stanford. I did my medical school at Stanford. I did my urology residency at Cleveland Clinic. I did my fellowship at UCLA. And that's all very, clinical focused, right? Learning how to be a surgeon, learning how to be a doctor, doing research. And then you go out and do practice. And so I landed in Seattle at a health system called Virginia Mason, now Virginia Mason Franciscan Health. And I was attracted to the people, the partners, right? Everyone wants to be with great partners. Kathleen Klobosky was my mentor. She was the section head at the time. And we had a fellowship. And in that time, we started a residency. It was a very vibrant multi-specialty practice with a great reputation in the area, and a lot of pool in the pelvic floor area. So I felt like I could start a practice. So, and that's how I got to know Mark Painter, because I got involved with the Washington State Urology Society. So it was our yearly annual meeting, which is like advocacy. But we also would spend half a day with Mark doing billing and coding. And so I was like a student every year there, learning billing and coding. And that's how I, got better at it, like little by little, keeping up. And that, made a big impact on me. So, and then, your practice evolves over time. Just resources change, in a multi-specialty practice, you kind of, there are factors that are a little bit beyond your control, whether it's, the staff are travelers, whether kind of just what you have. And so you learn to adapt to what the resources that you can sort of garner and utilize. And so I got to become very flexible. But I would say one of the turning points for me was, these terrible or excellent, whatever you want to call them, these Press Ganey reports. Which, as a little side note, I just got one in my email, and you get the scores, you get the comments, and I read through the comments, and then there was this beautifully written paragraph about me, and I was like, what is this? AI had written a paragraph based on all of the patient comments that I was like, what? Like, it was really like, it had filtered through all the patient comments and created this commentary that was like very strangely accurate. So anyway, I know people know about AI and everything, really cool. But I was kind of shocked at how like remarkably accurate it was. So anyway,
Mhm.
but that day I got not a great press Ganey report. It was, 5-star, great doctor, all these good things. And then there was one that really stuck out, and it was someone who didn't have a good experience. And I just, like, my heart sank. This is online, this is like publicly out there. And she wrote this paragraph about how she had a bad experience with a cystoscopy. She wrote about the discomfort. She wrote about how she had some bleeding afterwards. And, I thought, how can I turn this around so that this doesn't happen again? That was obviously not how I wanted my patients to feel or be treated. And I thought I was doing a good job, right? As we all do. And so one of the things Virginia Mason is known for is sort of patient experience, quality, safety, and this sort of improvement process. We call it Kaizen, right? This is the Japanese word for continuous improvement. And so they really dedicated to this method of improving things. So this, like, Toyota production system, they've actually applied it to healthcare and how we can transform it and really take these principles. And it's been a good experience. I've done some coursework in it. We apply it, and so I can, like, do my job. And, like, if you see a problem, you can, we call them rocks in our shoes. You can actually design a process to fix that, but not just once, but many times over. So I did that. I took my little capstone project of my coursework, and I said, we're going to transform cystoscopy for women, and we're going to make it about them and what they need and want. And so you bring in all these patients, and you do the simulations, you get data, you do surveys, and we ended up writing up sort of how to help patients have a remarkable experience with cystoscopy. And it comes down to empowering our staff to really take care of them. And the small things that they do to make them feel comfortable, help them be educated, help them, feel private in all the things that they could. So anyway, so expanded that into the clinic and each interaction with the patient, how to communicate in a way that their needs are being met. And I think that leads to clinical efficiency, because if patients are valued, listened to, they feel acknowledged, then it's not the time you spend with them, it's the quality of the connection. If they feel understood, then and they feel that they understand what's going on, that 10-minute clinic visit or 15-minute clinic visit can be transformative, because they feel like, this is a therapeutic, caring relationship between a doctor and a patient. And you can move on, and have these touch points with these patients. So that's been what I've done research in. That's been what I've been working on in my, clinical practice, whether it's overactive bladder or pelvic organ prolapse or urinary incontinence, how to better meet patients' needs. And it's been very helpful, and I think rewarding, because you're not just doing the medicine, you're connecting with patients in a different way. And if they're satisfied, then that helps a lot. And then I think also efficiency-wise, we talked a little about just individualizing your day to what's authentic to you and what works for you. I was actually amazed, John, at just how efficient you are. Like, every movement, every thought, everything is, like, so well thought out. I am not that way. I'm a little more, organic in my, and I have a lot of inefficiencies, but somehow still I'm efficient because I've worked on maybe doing things in flow, or connecting with patients, and so they feel like the time was very valuable, but it was a short amount of time. So I'm still working on my efficiencies. I don't have a dot phrase for everything. I should, but we work on it, right? We just have to do our best. I still I get home for dinner, I get all my notes done. I actually, Mark, I should say, I just talked to Shelby Morrisborough last night. She's like one of your A students too. And she's doing notes at night. And I'm like, Shelby, I'm not doing notes at night. Like, you've got to do it in the moment. I actually had a physician coach who timed if I do the dictation or the note later, it takes twice as much time as if you do it in flow. It takes you a minute or two, and then you move to the next patient. But you want to go to the next patient because you feel like you're late, right? And so how to resist those urges and get it done. Do the note, do the documentation. Do the billing, all in that little encapsulated time. So those are some of the things that we talked about.
Yeah, that was good. It was well received too, with everybody, I thought. So yeah, John, let's move to you, and then I want to go back to all the questions we had.
Yeah. So for those of you who do not know me, first of all, I want to say thank you for all the listeners, because I've been invited to speak probably 7 or 8 different presentations this year so far. I am actually passionate about helping urology practices succeed so they can reach maximum clinical and financial efficiency. And to that end, I created a Thriving Urology Practice Facebook group, and I think that's how many of you know me. And that's where we crowdsource practice management solutions for everyone's benefit, and it is all for free. I'm extremely honored to be part of this Institute for Leadership and Business course. And if you don't mind, I'll just quickly go over what the summary gist of what Pablo said. Within the first 3 months, he was able to beat his existing partners. His first 3 months of practice, he was able to beat his partners in production, in work RVU production. At the end of his tenure there in private practice, he was generating, I think, 14,000 RVUs. The national average is about 7,500, according to the national median, it was about 7,500 work RVUs. By the end of his tenure in private practice, he was generating 14,000 work RVUs. So this guy is extremely efficient, and he became a certified professional coder. And part of his success is he understood what brings value. And we all lament the fact that despite 14 years of training, or however many years, we are reduced to documentation and work RVUs. So when you're given these set of rules, it would behoove you to understand at least a little bit of the rules so that you're not spinning your wheels. And he also said, he clearly mentioned the importance of work RVUs, understanding coding and billing. And he and I both channeled Ray Painter in our practice. We both mentioned Ray Painter's name because he's kind of like the OG, the guru, when it comes to imparting wisdom on coding and billing and how urologists are so successful. Dr. Santa Maria also said, all urologists are not created equal in terms of production. And it is important for us to throw resources, the necessary resources for these productive urologists. And I mentioned the same thing in my talk. You have to utilize sufficient resources for your practice. I personally have 4 flexible, reusable cystoscopes, 3 ultrasounds. I have access to 6 different exam rooms, 2 procedure rooms, because I mentioned in my talk that the most expensive employee in your practice is actually the urologist. So whenever I'm in my practice, I need to be maximally efficient, maximally productive. I'm incurring the most amount of overhead when I'm here. I have the entire staff here, so I need to be maximally productive. And he shared the same sentiment. He also mentioned when he first started practice to reach out to the primary care docs, for the new urologists who are listening, reaching out and communicating, whether that is via phone, text, or physically visiting these referring doctors, will be helpful in growing your practice. And that's how he was able to exceed production relative to his partners so early on. And he was practicing in Georgia. This Hispanic sounding guy, Pablo Santamaria, down in Georgia practicing, starting out. And I think he mentioned in his talk that somebody said to him, I don't know if you're going to be successful down here in the South, starting down there with that kind of last name. But he was able to succeed and overcome any and all obstacles. What he said was really telling. Don't worry about the blue and the red. Don't worry about your party affiliation. Worry about the yellow and the green. Yellow being your patient and green being your revenue. So leave politics aside. Whenever you're advocating for yourself, making sure you keep your patients in mind and making sure that you understand financial statements. So when you are attending meetings with COOs, CFOs, CMOs, you can speak their language, understanding the balance sheet and things like that. And Dr. Lee, I really, the two things that you said in your talk, omotenashi and kaizen. So omotenashi, I'll let you talk about that later, but it's just basically, I summarize it as being fully empathetic to the customer, in our case, the patient. And kaizen, this is something I live by and I breathe every single day, continuous process improvement, kaizen. My talk, pretty straightforward. I didn't have anything exciting to talk about. I talked about you don't have to be all things to all people. You can pick the patients that you enjoy seeing. You can go direct to consumer, do the marketing yourself if you want to. Certainly using video, using different platforms to get the message out there so that so before patients or any customer buys from you, they need to know, like, and trust you. What is the best way to do that? Is through video. So consider putting video out there, consider using YouTube, and certainly pay attention to your Google reviews. I also talked about time and resource management, how I don't like to keep patients waiting because that will be really disrespectful to the patient and disrespectful to your staff. And also the trigger word of workflow or pathway. I talk about how you need to have a workflow and an efficient pathway from the time the patient calls you to seeing the patient to getting the bill out. So everything, you should have a process. And I think Mark mentioned during the talk that you want to lay out the process in light of all the turnover that's happening in our practices. So workflow optimization, and then documentation efficiency, the bane of our existence, documentation. The analogy I drew was your EHR, whether that is Cerner, Epic, it's like a Lamborghini Huracan, right? You never just buy the race car without taking a driving lesson in the race car on a race course. If you don't do that, you end up destroying the car or you end up hurting yourself. Same thing with the EHR. This is a powerful tool. Learning all the shortcuts will help you make your documentation life a lot easier. And some of the documentation shortcuts, such as using voice recognition, using scribes, using AI, we talked about that, making sure that you're leveraging your ancillary staff, meaning you want to work at the top of your license. Always ask yourself, is this something that I have to do? Or is this something that I have to do? If either of those answers is no, then somebody else is doing the task. So always keep that in mind. And lastly, of course, I talked about coding and billing. And I used a cool video, which unfortunately I can't show here, about the debate between Donald Trump and Hillary Clinton back in 2016 after the primary election, right before the general election. They were debating, and Hillary was saying that, well, Donald Trump, you did not pay taxes for 2 years. We got 2 years of your tax returns. You didn't pay any taxes. And his immediate response before she finished was, that's because I'm smart. So the analogy I drew was, he didn't pay any taxes. He got to keep more of his money because he knew the rules. He knew the tax law, or he hired someone who understood the tax laws. Likewise, to be successful, not only do you get to make more money, you get to keep your money if you understand coding and billing. Because keep your money, meaning these payers can take back what they paid you. I don't know if you know that. Those are the audience listening. Not only do they pay you, they can take that money back if they found out that you are billing erroneously. So anyway, that's pretty much a quick summary of my talk and summary of Pablo's talk.
Yeah, and it was, I tell you, I think it was all well received across the board, but the questions were really telling on some of the stuff that we ended up discussing a little bit further. And we did have quite an exchange overall, which was, as Una mentioned, the audience was very engaged and asking a lot of questions. So I think one of the ones that I remember the most was the guy was like, these are all great ideas, but my administration, basically has no desire to listen to me. How do you engage, the administration? And, that I think that was driven a lot by the fact that not only did Una do all these studies, but she was able to drive that through in a big organization, you know. So, that was one that struck me as a big one. And I think it struck with a lot of folks as, yeah, how do you get that support? How do you get when you know what you need to do, how do you get that support really given to you, especially from a large organization, which now a lot of people are in?
So the question that he posed was he really wanted to change, but on his administrator's wall in his office,
Yeah.
it says, it is what it is. And that is something that is pervasive in medicine, unfortunately. It is called status quo bias. We do it this way because we've always done it this way. And I think Una gave a great response. Go ahead, Una.
What did I talk about? You have to remind me.
Oh, you talked about how you were able to
Data?
effect change. Yeah, you used data, you went to administration, and how you were able to effect change in a large organization.
Yeah. I mean, I think you have to think, like, be in their shoes, right? And kind of think about what their priorities are, what language speaks to them. And often it's data and, whether it's and money, right? Like what financial gain is this going to have or patient access gain or whatever their metric that they're following, how is that going to improve the things that they're tracking? And so I think that you have to kind of better understand their priorities, their goals, and then see how this fits into and how it's aligned. And people are open to conversation. People are open to speaking, and I think it's about, there is a big part of this is relationship building and communicating in a respectful way. So, your initial response might be frustration, anger, even, all these emotions. And maybe, I mean, I talked about this, but maybe not to respond in that moment, although it's fine and that's natural. And, come at it calmly later with a little more of a cohesive argument with some data to back it up.
And solutions, right? I mean,
Yeah.
it's both. I mean, I think and we did, as we went through that was one of those things that, these administrators hear from one doc and how he's all upset all the time, and that kind of falls on deaf ears. That whiny doc that, like, blah blah, I'll just listen to him and let him go. Whereas, your approach was much more, look, the system needs this, press Gainey, we need these good scores, blah. So yes, finding where they're coming from to actually give them that motivation going forward. And there were several suggestions that came from us and from the audience on how to approach administration moving forward to affect change.
And one point
Mark-
go ahead.
I was just going to say, go ahead, finish your thoughts there, and then I'll go.
Oh, I was going to say, Mark brought up a good point. Individual doctors. Pablo asked you about how much a typical urologist produces, not from the work RVU production, but overall revenue to the hospital system. And it was in millions of dollars. And individually, a urologist may be just that small amount, maybe a couple of million, 3 million to the hospital system. But collectively, if we can, or that group can collectively come up with the idea to effect change and then go to administration and pitch that idea, then it's not just 2 or 3 million, it's tens of millions. That yields a little bit more leverage.
So true. And Mark, you failed to give us your summary of what you talked about, by the way.
Oh, well, I mean, I did my normal billing, coding, and RVU talk, where we talked about where those production numbers are and and how important it is to pay attention to your communication to everyone that's in the loop. So many times what you think is happening isn't what is actually happening. And if you don't actually ask the questions or respond to questions or get the data and respond to that data, it all requires a loop. So that was a big piece of, I think, where I was going with looking at where you are and how you can improve where you are. Because a lot of that is left just to happen in the background and to hope. And hope is never a good plan.
Well,
One,
and I also thought as I was listening and hearing this back again, the points, one of the things that we run into is if there's physicians out there or providers out there, practitioners that don't understand coding and billing, that takes up so much time and the documentation and energy and the frustration. So one of the things that all three of the docs that presented, all three of you had in common was that understanding of documentation, coding, and billing. So you had that kind of, you had that done so you could focus on other things and do other things because you weren't worried about that piece of it. So I think that was an interesting overall, I think, and maybe Mark, that was what you were trying to, that's the underlying current of the discussion.
Yep, I would agree. It is something that you see from physician to physician and place to place. Those who understand how to close their notes, ship their bills off, um, have a lot more leverage in everything, and they are more productive and more successful. I mean, learning that early, building those systems and protocols, and that was, as John mentioned, a big piece of, I think, where we are right now, where you have so much turnover in the marketplace right now that if you don't have good systems in place, you're reliant on an individual who now can potentially jump to a less stressful position with more revenue. You've got a big hole in your practice. So, building those systems around your personnel so that you can drive them in and out, and continuing to rely on yourself and your tools around you that aren't going to switch. Your EHR, your Dragon, your all of those things that you have available to you really are force multipliers that are not always leveraged across the board.
one
What do
thing
you
you said
think?
really stood out to me. Go ahead, Una.
Oh no, but you go ahead.
Oh, Mark, I was going to say one thing you said during the presentation really stood out to me, and it's something that something that I wish my staff has, my OR staff has, which is to have ESP, extrasensory perception, being able to read my mind. Come on, don't make me tell you what I want. Just do what I want without me telling you. And unfortunately, nobody has that ability. And I really wish people have that ESP. And it is truly something that we all have to be mindful of, is that we know what we want. I know what I want done, but being able to effectively communicate that is not so easy. It takes effort, intention, and effort. Go ahead, Una.
Yeah, and I agree with you. It's that there's an art to that communication, and it builds, positive patterns, but also positive relations. When you know people's names, when you explain the why, even in moments of stress or pressure, to communicate what you need in just sort of a calm way, but also the urgency of what it is. Even in your portal, in your messages on the EMR or verbally in the OR, there's so many opportunities to communicate better and more effectively with staff to accomplish what you need. So I think we can all be better on that, right? That's that continuous improvement. We can always communicate better.
Oh, big
with
time.
all our team members. Yeah.
Big time. I'm actually giving it. Go ahead.
No, go ahead.
Oh, I'm actually giving a talk in Louisiana at the Louisiana Urologic Society. One of the talks I'm giving there is actually on influence and communication. So super excited about that one.
I mean, people want to help people they like, right? And if you have that positive influence on people, and you can also lead by influence, right? You can lead by example, lead by influence. And I think that we all, as in our positions we are in, can do that. And it creates efficiencies. It creates better patient satisfaction. It creates better outcomes. So, yeah.
Yeah.
I was going to change this. Oh, go ahead.
I was just going to add in that whole people side of the equation. It's, you know, the business of medicine is provided by people to people. And that is one of those things that I think with all the technology and drugs and everything that we're out there, I often see it's forgotten that, it is about the patient and they're eventually trying to get to, if not a cure, at least to a better lifestyle. And then the delivery of that care is not just you, it's you plus support staff and a growing set, number of support staff that needs to be there. So if you can't communicate both to your patient and to those who support you, you are not going to be successful in delivering care in today's environment, even with all the technology that's out there. So
And
big piece of it.
Yeah, that's a skill that can be learned. That's a skill that can be learned. You can go too far in your efficiency spectrum and forget that there's actually a human on the other end, on the receiving end of your care. So always have to be mindful and learning some of these communications techniques and body language and things like that can really make you a lot more influential without dedicating a lot of time at the visits.
Yeah, so true. All right, let's hear from Ray, who sat through all the presentation, and get your general thoughts, and then we'll get some final thoughts and wrap this episode up. So, Ray, you were mentioned as the OG a couple times. So, what was your overall impression?
Well, it was fun to listen. And if I were to share all of my comments for the talk, we'd have to have another podcast. So I'll limit it. First, I'd like to say it's very refreshing to see that the AUA has put this segment in.
Mm-hmm.
As we've been doing this for the last 30 years, the AUA has been spotty as to what they've done for practice management support. So it's great to see this. And the things that everybody suggested is knowledge is power. And you need to know that part of your medicine, the documentation, coding, and billing. Empowerment of your staff, I thought was very well done by Dr. Lee, and also the patient experience. And I'd like to add one little story, because I think that what Dr. Lee has proposed and paid attention to also would prevent physician burnout. And let me give you a story. I started practice before we had ER docs, and initially I was in solo practice for a year before I started bringing in partners. And so there were interruptions that you couldn't prevent. And so I noted that if that interruption came at the beginning of the day or in the morning, so that I was late all day, and obviously patient satisfaction was not there, I was really tired at the end of the day. But if the day went well and that interruption came at the end of the day, and I spent the same number of hours in practice, saw the same number of patients, did the same work, I was not near as tired at the end of the day. So dealing with a frustrated patient is very tiring as far as being additionally frustrating. So Dr. Lee, I thought, did a great job in that. And John's talk on efficiency is equal in what empowers docs. And so I thought the program was really good. Thank you all.
All right. All right, let's go around, get some final thoughts, and then we'll wrap this up. Um, let's start with Dr. Lee. Final thoughts.
Yeah. Ray, I liked your comments. I've liked everyone's comments. I think we have to think about the meaning in our day and in each of these interactions and try to make it as meaningful and authentic and as connected as possible in the short time we have. And that's what really matters. So yes, and then we do all this work as well. But if you have that, then you're right. You're going to keep going, and your patients are going to be happier. And yes, there's some work to be done on the computer, but if you can keep that going, you're, like you said, you're not going to be as drained, and you're going to be invigorated because what you're doing really matters.
All right. John, final thoughts.
I think a lot of physician burnout is loss of agency and loss of control. Understanding some of these coding and billing rules, understanding the EHR, understanding some of the tools that you use, technology that you use to make your lives easier will be a great thing to do. I like to remind everyone of Kaizen, continuous process improvement. Never be satisfied with the status quo. Always think of better ways to do things with everything you do in life. Back to you, Scott.
All right. Very well said. Mark, final thoughts.
So I would say a couple of different things that I took away from working with these guys and from the presentation in the audience. One was that, this whole process is a puzzle or a game that you really need to play and understand instead of fighting it all the way and complaining about it. The healthy attitude of identifying that, hey, I got an issue. Now I can solve it. I just need to figure it out. That process of working through things and making them better with that end game is or the end goal is part of that game of life that we play. And remembering that, between communication and proper preparation and that continued desire to make things better actually does keep all of us, I think, in the game a little bit more. So I appreciated not only the presentations, but our preparation and our meetings and how we all were influenced by each other in our discussions. So it was a great experience overall, and I look forward to hopefully doing it again soon, perhaps next year.
Ray, final thoughts.
Final thought is you got to continue to have fun. Don't let the gremlins get you down. Remember why you went through everything to become a urologist.
All right. All right. We'll end this episode here. Want to once again thanks ModMed for supporting this episode. If you're in the market for an EHR or a practice management system, you can go to modmed.com/PRS network for specials for our listening audience. We want to say a huge thank you to John Lynn and Una Lee for joining us on this podcast. And we want to have you on many times in the future. We got some great things to say, and we want to dig deeper in all those things. Those are just awesome. Really, really appreciate it.
Hey, Scott.
And yes.
On a practical note, what can urologists do? What can billers do in any sort of training, any upcoming training to help improve their coding and billing mastery?
We have something that's really exciting coming up. It's our Urology Advanced Coding and Reimbursement virtual seminar. So it's going to be a Zoom meeting, and we're going to have Dr. John Lynn and Mark are going to be our presenters. That's coming up on July 27th from 9:30 a.m. Eastern time to 1:30. So it's a 4-hour block, and be very interactive. And we're really focusing on those things that impact urologists and urology practices the most. And that because it's a condensed version of our Urology Advanced Coding and Reimbursement seminars that happen in December and January in Las Vegas and New Orleans. So this is the virtual version of that. So can go to the episode, which is the episode page, and there's links there. It's prsnetwork.com/196 for episode 196. So we encourage you all to sign up and get your colleagues to sign up. It's a great thing. And if you can pick up one thing out of everything, it'll help. So, and hopefully you'll pick up a lot more, but all these little things add up, as you've heard on today's episode. That's all we have. And we thank everybody for listening. Thank you all. You're what make this podcast. That's it. Pick us out, John.
Happy coding.